As a medical student, that was what I was taught. That is what is taught to medical students even today. Diagnosis, cure. And when cure is not possible, sorry, we cannot do anything, and they are sent home. This happens in 80% of the global population. It is someone's right to be treated as a person and not just as a container of disease. Palliative care is treatment aimed at improving quality of life, whether it be physical problems like pain or vomiting, or emotional problems like anxiety or fear or depression, or social problems like stigma, isolation. All these are identified, and you take away what you can and thus improve the quality of life. We are not negating the disease. The disease is there, has to be addressed, but at the same time, the person as a whole is given attention to. You can call it holistic care if you like. Opioid medicines like morphine, which are unavailable in most of the world. We call it opiophobia, fear of opioid substances. The word morphine seems to strike terror. You talk about another drug like fentanyl, which belongs to the same class. It is not familiar, so that's okay. That kind of opiophobia is a part of the problem. But the way we use it in cancer, for example, as tablets, it's very, very, very unlikely that it can cause addiction. But the name has that association. And because the name has that association, the fear is profound. Possibly following America's war on drugs, very stringent regulations came up in many countries which prevented the availability and use of these medicines. The cost of palliative care, etc., are not really major barriers. They can be overcome. So we have this paradoxical situation in developing countries among poor people. They cannot get the inexpensive morphine, but they can get a transdermal fentanyl patch which costs 150 times as much. Both are covered by the same regulations, but the expensive medicines are available. This is a global issue. It really hurts in the developing countries. Death is the inevitable consequence of life. The medical system has the responsibility to make that life and that death, when the time comes, as easy as possible.